Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us, and it's always an honor to have Dr. Jennea Wood of Tummy Temple, and she is talking about healing heartburn naturally, which can really ruin someone's day with some heartburn. So she has some wonderful tips and tricks to share with us. Thank you so much, Dr. Wood.
Thank you for the introduction, and thanks as always to you, Elizabeth, and to Marlene's for hosting this education program. It's a really neat offering, and I'm so happy to be here. So, hello, I am Dr. Jennea Wood. I'm a naturopathic physician with Tummy Temple. I'm based primarily at our Lacey location, but I do a lot of telemedicine as well. And gut health and optimizing gut health, treating heartburn, and all other manner of gut issues is one of my main passions. I also treat a lot of autoimmune disease, eczema, mold illness, so, some other things as well, but this is kind of a central thing. And yeah, I'll just dive right in. So heartburn is, I'm just gonna give a little kind of primer on what exactly is going on here. It's when the contents of the stomach are allowed to reflux upwards into the esophagus, and it causes obviously irritation, inflammation in the lower part of the esophagus, can even make it all the way up to the mouth and cause dental erosion, not to mention that horrible burning feeling. So if this process is allowed to continue long term, this is not, it's not a given, but a small percentage of people will develop precancerous and then sometimes even cancerous changes in the cells of the esophagus because those cells are just not designed to be constantly bathed in stomach acid. So the symptoms can be burning sensation in the chest or throat, although some people have silent reflux. They'll get like a weird acidic metallic taste in their mouth, but won't really have that burning sensation. Um, Sometimes people will actually reflux partially digested food back up the esophagus into the mouth, sort of throw up in your mouth a little bit. Can come with nausea, an acidic taste in the mouth, like I mentioned, or cough or hoarseness. So in the conventional world, some of the most common medications used to treat it are proton pump inhibitors, which are medications that suppress the production of stomach acid, such as omeprazole, also known as Prilosec, esomeprazole, also known as Nexium, pantoprazole, also known as Protonix, and then there's another class called H2 blockers, which just in a different way also block stomach acid production, like Zantac and Pepcid. And then sometimes antacids like Tums are used, which are calcium carbonate, and that's just used to, neutralize stomach acid that's already there. So, what is the problem with this approach? Because, it can work. It doesn't always work. Sometimes people still have heartburn, but it can, keep the symptoms at bay. However, using either acid blockers like Prilosec or acid neutralizers like Tums for acid reflux, it just covers up the symptoms, but actually makes the cause worse in a lot of cases. So you may not feel the burning sensation anymore because the acid levels in the stomach are now so low that the esophagus is no longer bothered by them. However, the root of the problem, which is the bottom of the esophagus, is still hanging wide open. So there's actually a little bit of anatomy. So the esophagus is this tube that travels from the mouth down to the top of the stomach. And let's see, I can sort of demonstrate on myself. So ends about here, and then the stomach opens out. Um, and there's a sphincter, a little band of muscle like that, that is at the very bottom of the esophagus. And that sphincter is meant to stay closed all the time except when we swallow. And then it opens up to allow the food through and then should close back again. So, one of the main issues that's happening with reflux is that uh, that it's called the lower esophageal sphincter, or the LES, is just hanging open. It's not doing its contractile thing. So, the medication is just suppressing the stomach acid so that there's still acid, there's still stomach contents splashing up through that open LES sphincter, but you just don't feel it anymore. But if you were to stop taking the medication, the symptoms would just bounce right back. Might even be worse because when you take those medications long term, the stomach kind of responds by oftentimes producing more of the cell type in the stomach lining that makes stomach acid. So then if you stop taking the medication, you actually have more acid being produced than you did before you took the medication. So it can be sort of a vicious cycle. Um, oh, and as Elizabeth said, I am perfectly happy to answer questions as we go. So if you want to post them in the chat or unmute yourself and ask, go for it. So, proton pump inhibitor medications were actually really not designed to be taken for more than 2 weeks at a time. When they were initially released, that was the recommendation. But these days, people and, even children and babies are routinely given these medications and instructed to keep taking them for years or even decades. So, to understand why suppressing stomach acid in the long term is harmful, first we have to go into what role stomach acid plays in our physiology, what it does for us. So, as a naturopathic doctor, my training led me to understand that the body has very good reasons for the things that it does. It's not just accidental. So, we make stomach acid for a lot of good reasons. Um, it kills off bacteria that might be left over in the food that we eat. So, it helps protect us against food poisoning. It starts the breakdown of food, particularly protein in our diet. So if we're missing stomach acid, it becomes harder to digest protein. It triggers the release of an enzyme called pepsin from some of the cells lining the stomach, and that enzyme also contributes to breaking down the proteins that we eat. It aids in the absorption of minerals such as magnesium, sodium, and iron. And then the same cells that make stomach acid also make a protein, a very important protein called intrinsic factor, that's needed to absorb vitamin B12. And so our absorption of B12 can be negatively impacted as well. And that's a vitamin that we need for cognition, for energy, for just making more DNA so that our cells can divide when they need to. So, long-term use of proton pump inhibitors can predispose you to food poisoning, bloating, and irritable bowel syndrome due to incomplete digestion of your food. Oftentimes, a heavy feeling when you eat meat because the meat just kind of sits there and doesn't digest as well as it should. It can lead to malnutrition due to poor protein digestion and decreased absorption of minerals. And these medications can lead to B12 deficiency. And then taking it another step further, long-term nutritional deficiencies caused by proton pump inhibitor and antacid use can cause or contribute to anemia and fatigue, osteoporosis, skin problems, including rosacea, slow or impaired wound healing and injury healing, depression, brain fog, and poor memory from the B12 deficiency, numbness and tingling in the arms and legs, also from B12 deficiency, and dementia, also from B12 deficiency. So, the actual, one of the main causes of acid reflux, as we touched on a little bit already, is dysfunction with that lower esophageal sphincter at the bottom of the esophagus. So then stomach contents reflux up into the esophagus, which is not meant to deal with those acidic contents. So then the cells in the esophagus become inflamed, um, and that causes that burning sensation. And then over time, the cells of the esophagus can actually change to become more like the cells that line our stomach in order to withstand the constant acid bath that they're receiving. But having that change of cell type, if that progresses too far, if there are enough cellular changes that kind of pile one on top of the other, that can become cancer. Just want to mention that this is true in the majority of cases with reflux. However, it is possible. There are much less common conditions in which people truly do make way too much stomach acid. And so, very occasionally that can actually be the case. Usually, though, it's actually the opposite. So let's see. I think I jumped ahead and explained the lower esophageal sphincter. Um, oh, so let's see. Oh, couple questions popping up. Is pantoprazole a PPI? Yes, it is. Yes. Okay, so we kind of covered what the lower esophageal sphincter is. It's meant to stay closed. So what's going wrong? Why is it hanging open in some people? Um, One of the things that's going on is that one of the signals, there's a chemical signal that reminds that sphincter to stay closed except during swallowing, and that signal is actually the acidity of the stomach. So in an ideal state, the stomach maintains a pH of about 2, which is really, really acidic. And it does that by constantly manufacturing hydrochloric acid as needed to maintain that really acidic pH. When there's not enough acid present, then that chemical signaling is missing, and that sphincter becomes sort of floppy and remains partially opened, allowing the still relatively acidic stomach contents to reflux upward. So, maybe the pH has gotten to a 4 or a 5, which is not acidic enough to tell that sphincter to stay closed, but it is acidic enough to feel like burning when the stomach contents are splashing up into the esophagus. So that is very commonly one of the things that that is behind or at the root of heartburn or reflux. Other factors that can affect the lower esophageal sphincter include constipation, where there's a lot of backed up stool in the lower abdomen, which is actually exerting upward pressure and kind of throwing off the dynamics in the stomach and esophagus. There's actually you may have heard of hiatal hernia, which is when the top of the stomach has kind of pushed up through the dome of muscle that makes up the diaphragm. The diaphragm is our main breathing muscle, and there's a little hole in the diaphragm that the esophagus goes through. And then the stomach opens up just below that hole. So a little bit of the stomach can actually like kind of pooch up through that hole. That's called a hiatal hernia. And then in naturopathic medicine, we recognize something called hiatal hernia syndrome, which is where on imaging, there may not actually be a true herniation, where the stomach isn't actually shoved up through that hole in the diaphragm, but the stomach is sort of tightly pressed up against the top of the diaphragm in a way that still causes some dysfunction. So we'll get into that a little bit more later. Peppermint relaxes the lower esophageal sphincter. So when people are already prone to heartburn, a lot of times peppermint is a trigger. And then food intolerances tend to worsen heartburn. So that can be really individual to each person. So, for one person that might be wheat or gluten, for another person that might be dairy, etc. So getting into things that we can do to help. Um, a lot of people are aware of heartburn triggers. There are a lot of common heartburn triggers that are often common to most people. Um, it's important to note that these foods are not the cause, they're not the root cause of the heartburn. If they were, anyone who ate these foods would have heartburn, and that's not the case. But they are a trigger for people who are already susceptible to this condition. So avoiding them can offer some relief while we work on the root causes. So they include spicy foods like salsa and hot sauce, coffee, chocolate, and caffeine, greasy foods, cigarettes, smoking, tobacco, alcohol, cannabis, peppermint, like we mentioned, or like I mentioned, and then acidic foods like tomatoes and citrus, carbonated drinks, and refined carbohydrates like cookies, pastries, bread, and pasta. And sometimes people just have one or two of those things that are their triggers. So the next thing that you can do to help is pay attention to how you eat. So your body can't make stomach acid properly, or make enough of it to digest your food fully if you're stressed out or rushed while you eat, or if you don't chew your food thoroughly. So it's really important to slow down, give your body a chance to do its job. It takes time for your brain to signal, to your mouth to make saliva, to your stomach to make stomach acid, to your pancreas and gallbladder to make digestive enzymes and bile. There's a cascade of signaling that happens, and it started off by thinking about food, by smelling food, by preparing food, by just the enjoyment and taking the time to stop, so slowing down, maybe having a little gratitude practice gets you into more of a rest and digest state. I recommend, even if you're a bit on the rushed side, seeing if you can just take 10 belly breaths before meals to help prepare. Sit down while eating, and ideally really avoid eating while rushing around in the car. Chew each bite until it's basically liquid. And then avoid eating within 3 hours of bedtime. Just having a full stomach when you go to lie down is certainly not going to help things. If still working on getting that lower esophageal sphincter to stay closed again, if it's still hanging open and you go horizontal too soon after eating, that's going to be a major problem for reflux. And then avoid overeating. Just having too much pressure, too much food in the stomach is just going to make reflux worse. So, trying to stop eating when you're about 80% full, because the satiety signals take a little bit of time to catch up. Then you won't overfill your stomach and cause more reflux that way. I'm gonna pause for a sip of tea. My colleague, Heidi Oxner, usually co-teaches this class with me, and unfortunately she is sick this week, so she's not able to be with us. So I have fewer breaks to sip my tea. Okay. So, for some people, as I touched on briefly, certain foods other than those that I listed above as triggers will worsen their acid reflux. So that might be a sign that you have a food sensitivity or a food allergy. Identifying those, those individual food reactions in yourself can actually be a really, really crucial step to resolving heartburn. What I usually do is either people have my patient do an elimination diet, going through and avoiding the most common trigger foods or the most common food intolerances, and then adding them back one at a time. Or sometimes we'll start with a blood test through US Biotech. It's food intolerance testing, and it's a blood collection. They test your blood for the one I usually use is 96 different foods. They do have expanded panels that are even more foods beyond that, but the 96 food panel pretty much covers the all the, most common food reactions and just a pretty broad list of things. Um, and they look for a certain type of antibody against those different foods. So that's one way that we can react to foods. Um, and that basically provides us a short list or a template, and then we do an elimination challenge diet with that. So, whatever foods come up on that testing, have you avoid them for a time, and then try reintroducing those. So that can be really, really valuable information in resolving heartburn. Checking in on hormones can be really useful. So, elevated progesterone can relax the lower esophageal sphincter. Um, and so, progesterone levels are high during pregnancy, which is one of the reasons that pregnant women are prone to heartburn. The other reason is the growing baby that is squashing your stomach upward against your diaphragm. And then non-pregnant women can also develop or can develop hormone imbalances with low estrogen and high progesterone, which can contribute to heartburn. So having your doctor check your hormones or coming in to see myself or one of our other naturopathic physicians, and we can check your hormones for you, can be really valuable. Symptoms of excess progesterone include feeling bluesy or, increased weepiness or emotional feelings, breast tenderness, mood swings, waking up groggy, bloating or like retaining water weight, and a little bit of dizziness or kind of unsteadiness. So there are some wonderful herbs that can be really valuable to help along the way with heartburn. Um, Most of these herbs have a slippery quality when mixed with water. So they can be used to essentially coat the esophagus and stomach lining as you swallow them, and therefore they help to soothe and heal inflamed tissue. So I usually one of the products that we often use is already a combination product, um, but you can combine these also and use them between meals or as needed during bouts of reflux. So the first one is called IntestiHeal, and I'm actually going to post a link to our product collection. So everything that I talk about here um, is linked uh, in this collection. And let's see, there we go. So you can take a look if you're curious. Um, okay, so IntestiHeal is a powder that we manufacture in-house at Tummy Temple. It's a combination of slippery elm, marshmallow root, um, licorice, a little bit of ginger, and then it has L-glutamine, which is an amino acid powder that helps with healing the gut lining. So that's a really useful one. That would be like a tablespoon mixed in 6 ounces of water, maybe 2 or 3 times a day for heartburn. Or aloe vera juice or gel. And you would do, about 2 ounces or so, maybe 3 times a day. um, as needed. You do want to make sure you get the right type. So aloe vera juice comes in either the whole leaf form or the inner fillet form. The whole leaf form has some of the laxative that's in the outer skin of the leaf, or the latex, which has laxative qualities. So if you are constipated, that might be a good option for you. It's got the gut healing piece and then also a laxative piece. But if you are not constipated, you definitely don't want that version, and you should get the inner fillet form. And that will just be soothing and healing, but not laxative. Temple DGL is a formula that is little tablets of licorice made into chews. So you chew 1 or 2 tablets, again, maybe 3 times a day or as needed for heartburn. Um, DGL stands for deglycyrrhizated licorice. The glycyrrhizin is a compound in licorice, and taken in high amounts, that it can raise blood pressure. So this form has had that compound removed, so this will not raise anybody's blood pressure. Still, I mean, you would have to take pretty large quantities of regular licorice to have that effect, and it's not, it doesn't have that effect on everybody, but still, it's worth being a little cautious about if you do have high blood pressure. And then a final soothing option is called esophageal guardian. This is a different type of chew. This one has a type of algae in it that once it hits the stomach contents, swells up and creates sort of like a raft that sits on top of your stomach contents and keeps them down, prevents them from splashing up into the esophagus. So it sort of forms, I mean, it's not like a wall, but a soft barrier um, that'll last an hour or two. So that can be a useful tool as well. Okay, just checking on questions. Um, okay. Um, the next area I want to touch on is, physical body work approaches to heartburn. So, an often overlooked factor that can cause or worsen heartburn is that hiatal hernia syndrome that I talked about. And that's where the top of the stomach presses up against the bottom of the diaphragm, or maybe even in a true hiatal hernia, herniates through that hole that the esophagus is meant to go through. And so there's a gentle abdominal massage technique that I am trained in, and most of our naturopathic doctors are trained in, that can help to correct this syndrome and can often offer immediate and dramatic relief from heartburn. Um, so, that's something that I will sometimes have people come in specifically for that. And, maybe they'll come in for a session, an initial 1 hour appointment. We'll be able to do an intake, talk about their case, get them set up with a plan, and do a little bit of this adjustment. Um, and then maybe they'll come in for a 30-minute follow-up a few more times to just kind of keep working on the alignment of the stomach. And it's a really, really helpful thing. I have a lot of patients that find this incredibly valuable in addressing their heartburn. Um, and yeah, some of our massage therapists up in Seattle are trained in abdominal massage as well, and that can be really soothing and useful. The next step is actually, in many people, it's helpful to increase your stomach acid with using foods or herbs. So that for a lot of people sounds really counterintuitive because in the conventional world, we're essentially told you're having this because you have too much stomach acid. We have to suppress the stomach acid. And most of the time, that's not the case. So sour and bitter foods actually affect our taste buds in a way that signals are then sent to the stomach to produce more stomach acid. So taking some sort of food or digestif or something about 15 minutes before meals or large snacks can be a really valuable way to get your body producing more stomach acid. I saved this recommendation for last because for people who've been struggling with heartburn for a long time, especially those who've been taking an acid blocking medication, going off the medicine and increasing stomach acid can sometimes at least temporarily worsen their symptoms. So addressing the other things that we talked about today first is gonna, work a lot better and go a long way toward making this more easy, making it easier to wean off the medication. So, first would be a bitters formula. So the one that we carry is called Temple Bitters. It's actually, ours is not that bitter, but it still has a really good effect on stimulating stomach acid, and it has some calming, soothing herbs in it as well, which helps kind of get you shifted into a rest and digest state in which all of your physiology is going to be better aligned to help you digest your food, help you make stomach acid. I know Marlene's carries some bitters as well, probably Moonshine Herbals, which is a great company. So, there's lots of options out there. Bitters have been around forever. A lot of cultures have used them traditionally in a digestif type of beverage that you drink with a meal. And it's for this precise reason. It's helping your body produce more digestive juices to help you digest your food better. It's a really nice way that culturally this has kind of been added in. Let's see, maybe some more questions. Is the gentle massage an option even if you don't know you have a hiatal hernia? Absolutely, yes. So what I do is I do an assessment where I press on some reflex points that are on the abdomen and gauge. They actually kind of give me clues about whether there's a hiatal hernia syndrome picture going on, whether stomach acid is low, whether digestive enzymes are low. So that's part of the assessment I do on every single patient that walks into my office. So yes, I will often do that. And or I will pretty much always do that. And then based off of those results, do an adjustment if it's indicated. I like Elizabeth's comment. Bitters are better for you, so don't be bitter about adding it into your digestive health protocol. Precisely. So sour flavors also have this effect of helping us produce more digestive juices. And so bitter flavors, interestingly, trigger our bodies to produce more stomach acid, more digestive enzymes, more bile, and then also increase motility. Whereas sour flavors have a bit more of a targeted effect just on stomach acid production. So they both help with stomach acid production. Bitters also have these other digestive benefits. But again, lemon juice, so you would squeeze maybe a quarter of a lemon into a little bit of water, couple ounces of water. It should still make your mouth pucker. So it doesn't have to be straight lemon juice, but sour. And drink that down 15 minutes before meals. Or you could do a 1/2 to 1 ounce of apple cider vinegar with a little water. Choose an organic one like the Bragg or Spectrum brands. And then you can do the same thing with bitter greens, actually. So that's a way, another cultural way that people have been doing this naturally by having a little bitter green salad at the beginning of your meal. You're getting that bitters effect from, so you could do this with dandelion greens, endive, or kale. So yeah, you could even have a little salad of bitter greens with apple cider vinegar or lemon-based dressing on it. So, you can get creative and make this a food-based treatment. Let's see. Oh yeah, we have a comment. I know there are Italian digestives, but they have alcohol in them. Well, the bitter formulas that I'm talking about, um, are Temple bitters and then the moonshine bitters that I mentioned. They are tinctures. They are alcohol extracts. So it's not a lot of alcohol, and the dose is 1 dropper full. So it's a teeny tiny bit of alcohol. In this case, I'm not recommending you put it in a cocktail. You could do that, but just for health purposes, you just put it in a little water. So it's a teeny tiny bit of alcohol. Um, but yes, that is how they're made generally. In the digestif, like cultural tradition, yeah, they are added to a cocktail. That is true. If you cook the dandelion, does it still help? That's a good question. Probably, but maybe not quite as, it's probably still bitter. It would probably be fine. Yes. Okay, and then so those are all ways that you can kind of help your body produce more stomach acid. Sometimes, I mean, just with age, our bodies produce less stomach acid. That's just something that happens to all of us as we age. So sometimes it is actually really valuable to um, add in additional stomach acid, not just rely on these bitter or sour formulas to try and get your body to produce more. This can also happen due to nutrient deficiencies, particularly deficiency of zinc and vitamin B1. So this can be, again, a bit of a vicious circle that can happen. So stomach acid aids in the absorption of trace minerals. And so, if we have lower stomach acid over months or years, then it's going to be harder to absorb our nutrients. And therefore, we can get deficient in the nutrients that are needed to make stomach acid. And hence the cycle continues. So in that case, at least in the beginning, for the first few months, taking additional stomach acid in supplement form, it's called betaine hydrochloride, can be a really valuable way to kind of break that vicious cycle, help your body absorb minerals and nutrients again, so that you can rebalance and get back to the point where you are more capable of producing stomach acid. And then in some cases, it just is a useful thing to take long term because, as I said, we do just make less stomach acid with age. So we usually use, there are 2 different products. Biogest is just additional stomach acid and a little bit of bile support, or we have another combo formula called Temple Total Digest that contains the betaine hydrochloride, the stomach acid, as well as some enzymes and bile support. Oftentimes when I put someone on a formula like this, I also put them on a trace mineral supplement and a B complex, or just, a good multivitamin for a couple months so that they're better able to kind of absorb those nutrients, replete their nutrient stores while they're taking the betaine hydrochloride supplement. And then betaine hydrochloride actually helps strengthen the lower esophageal sphincter. So it helps kind of close up that issue. And we also will sometimes use a supplement called D-limonene for this. But other supplements, including lecithin and melatonin, can also be helpful for strengthening the lower esophageal sphincter. So, we're trying to get the stomach acid back up, and then also there are these other tools that we can use if needed to help get that sphincter tone working again. And then finally, just want to say, this can be a bit of a process. It's not, sometimes you just take one supplement and it seems to fix it and you're good. But a lot of times, it takes a little finessing, doing the testing for the food reactions, step by step, adding things in if needed. So I think getting customized support, coming in for a visit, getting appropriate testing, and getting an adjustment, all of those can really be valuable additions. So, if you're struggling with this or have had this for a really long time, I would recommend that. And then if you're already taking a medication like omeprazole or another proton pump inhibitor, H2 blocker, or Tums, especially the two former categories. As I mentioned, sometimes initially you can have what's called rebound hyperchlorhydria or, rebound excess stomach acid production. And it's better to have a practitioner, a doctor on board who knows how to help you through that process. Um, sometimes acid reflux can present as chest pain. And so just want to name that. And, if you're having like a lot of pressure and pain, you don't want to just assume it's acid reflux and it turns out to be heart-related pain. So, you know, um, if it's a new kind of pain or worse pain or radiating to your arm or jaw or lasting longer than usual, that's a time to really, get checked out. Call 911 even if it feels off to you. You're not sure. And then another just caution about using betaine hydrochloride supplements. Our stomachs are made to tolerate having very acidic contents in them. However, with chronic inflammation, the thick mucus lining of the stomach can get worn thin, and then sometimes people can lose their tolerance for the intense stomach acidity. And so in those cases, and that's also something I always assess on exam during a visit, I'll press around and do an exam of the stomach area. And if the stomach seems to be inflamed, I can pretty much tell you you're not going to tolerate a betaine hydrochloride supplement yet. And so, if you put yourself on one of these supplements, if you try it on your own and you find that it causes a burning sensation in your stomach, or causes pain or causes more reflux or anything like that, then you probably have some degree of inflammation and wearing down of that mucus lining. If it gets to a certain degree, it can be termed gastritis, that's the medical term for stomach inflammation, or even a stomach ulcer. In that case, you should not be taking betaine hydrochloride. So you should definitely stop taking it and meet with your doctor. And then also, if you've had heartburn for many years, it's important to have an endoscopy, and that's a scope looking down into your stomach to check for precancerous or cancerous changes in the esophagus. So, that's not very common in younger people, and there has to have been reflux for many years. But if this has been going on for many years, I highly recommend doing that. And there is actually a type of specialized testing that can track the acidity of the stomach using a special capsule. It's like a little tracker capsule that sends out little signals of what the pH is at different places throughout the intestine. So that can be a useful test when someone's had a really chronic issue going on to see um, you know, is there enough acidity? Is there too much? So that can actually be really important in those much less common cases of excess acidity. So, if you've tried these other things, they're not working, you can speak with your doctor about being referred to a gastroenterologist to have that type of testing. So, let's see, a couple more questions. Um, what are my thoughts on colonics? Well, we offer colonics at Tummy Temple, and I think they can be really valuable. So, if someone's really constipated and has that like upward pressure of the lower intestines, pushing up on the stomach, then that can be really valuable to do a couple colonics to help clear things out, and that can be a part of resolving heartburn. It also plays a role in gentle detoxification. So I think they're a good tool. Is low acid coffee less likely to cause digestive issues? I don't know about that. I'm potentially for some people, but that's one of those things where It might be a trigger of heartburn. It's not, it's not the root cause. So it might be a little bit easier on the stomach. Um, some people just, coffee doesn't feel great on the stomach lining, and I could imagine that that could be a little bit helpful. And yes, Dandy Blend is a great coffee alternative. I like that one a lot. Um, all right. And then do I think uh, that helps strengthen the bowels? I'm not sure what you meant by that, Elizabeth. Do I think what helps strengthen the bowels?
C- with getting the colonics done.
Oh, I think it is. It's sort of like a workout for the colon. So, yes, it can sort of retrain colon motility done correctly. All right. Well, that is all I have for you this evening. I think I covered all the questions that people had posted. If you have any more questions, feel free to ask them. Um, but yeah, thank you so much for being here. I appreciate you showing up and all your wonderful questions. This is my passion to help people heal their gut. So glad to have you here. And one more question. What's my thought on sleeping position? Um, this person has trouble sleeping on their right side and are having acid reflux and have to take DGL. Mm, I mean, I will sometimes have people purchase a wedge, kind of a sleeping wedge to raise their torso up by, some degrees to help with reflux. Um, I don't know that I've particularly seen the right side be a bit worse than the left side or something like that. Although I know some people just have individual preferences and, individually will notice one side is better than the other. I don't know if I've seen that play out, to always be a pattern. But the wedge can be useful while sorting out the other pieces. Yes, the class is being recorded, and so it will be. Oh, so that's one last thing that I meant to mention. I always send out a follow-up email. I try to get it out by the end of the week, but I'll have to get your emails from Elizabeth when she's able to send them over. We don't sign you up for a mailing list or anything like that. We just send the one email out, and that will include a link to our uh, to the product collection discussed today. It will contain the recording or a link to the recording from the class today. Um, and we always offer $20 off your first visit if you'd like to schedule a visit in the next week. You don't have to come in within the next week, but you do have to call and schedule the appointment within the next week. And there will be a 20% discount code that will also be good for the next week after the email goes out, in case you want to try any of the products in the product collection. So anyone who's signed up for the class today, even if you weren't able to attend, will get that email. And yes, absolutely, you can. You'll also be able to find the recording of the class on the Marlene's YouTube channel, probably posted within a few days. So I think that covers everything. Again, thank you so much, all of you, and thank you, Elizabeth and Marlene's, for hosting.
Of course, Dr. Wood, my absolute pleasure. And you are a staple in our education department, and anytime we have the honor to host you is just like an absolute treat. So really
Thank you.
appreciate your expertise and all that you do in the community. And I mean, really everyone at Tummy Temple, everyone is so skilled in many different other expertise too. So definitely check out Tummy Temple.
Thank
They're
you.
no, you're welcome. You're at the Lacey location, right? And then there's the Seattle one, right?
Yes, yeah, we've got two locations. Um, well, it's absolutely my pleasure. I hope you all have a great evening.
Thank you.